not just the hospital association, but coming from my background as a conservative, this is one of the only laws the government has to protect us from all the other government laws and regulations that we, as healthcare providers, have to abide by.
So this is something that you say is a conservative piece of North Carolina's laws.
Well, when you look at what people want, a lot of times you hear people want the free market in healthcare to control. You want the market forces to determine where and when you have healthcare service delivery. The problem with that is a free market means no government intervention and no government controls. Absent CON, you still have government controls. You still have government forces that have a heavy hand in everything that medical providers do. And so with those in place, there is no free market. And then that leaves you to decide, well, what is the government's role then if they're already controlling? And I believe it is, if you're going to control, you should make it fair for the providers and fair for the citizens that are suffering, word used intentionally, suffering under that law. We have a lot of legislation and rules coming from the federal government, not just the Affordable Care Act. Long before that, we had the Emergency Medical Treatment and Active Labor Act that requires hospitals to treat everyone who walks through the door, no matter what their payment situation. That's a lot of free care that hospitals provide. You have all of the Medicare rules, and when your population is half funded by Medicare, you have to follow those rules because you have to treat those patients in order for your hospital or your medical practice to be viable to serve everybody else. So it is, in my opinion, it is the one government regulation that protects us from all of the other government regulations.